everyone, and welcome to today's Consumers First webinar on Fighting to Put People's Interests at the Center of Healthcare Payment and Delivery, a Critical Opportunity. Thank you all for joining today. My name is Jane Sheehan. I'm Director of Federal Relations at Families USA. So before we get started today, just a quick bit of housekeeping. This webinar is being recorded and will be it'll be available to be shared afterwards. Today's webinar is going to be a 30-minute conversation, so we're going to use the most of your time and our time here. I'll go over the agenda in a minute. We will have Q&A at the end of the webinar, so please use the chat box on your screen to enter your questions throughout the discussion, and we'll get to those at the end, leaving plenty of time. So I am going to quickly walk through today's agenda. We're going to give you a little bit of background about who Consumers First is, who we are, and what our mission is, and the key groups involved. Today's webinar is going to focus mainly on the Inpatient Prospective Payment System, IPPS proposed rule that is right now open for federal comment. This is a rule that the administration updates annually and solicits feedback on, and there are always comment periods open prior to the implementation of the final rule. So that's what we're going to discuss today. We're going to talk about how this rule impacts payment across the health system and why it's so important for our groups to comment on. We're going to walk through the scope of our sign-on comments and how you can add your organization's voice. So a little bit of background on Consumers First. We formed this alliance in the spring of 2019 as an effort from Families USA and 6 other leading groups representing consumers, labor, employers, and providers. Now, work to address healthcare value isn't exactly new, and there have been various reform efforts for decades now, but our healthcare system still remains the most expensive of any country, and we continue to lag behind fellow countries and peer countries in the quality of our care, access, patient outcomes, population health status, and efficiency. So last spring, we released a call to action, and really, the call to action, it was time for a vibrant, robust network of consumer health organizations, employers, labor unions, healthcare professionals, and other leaders and stakeholders from across the country to join in our efforts with the main goal of uprooting the fundamental distortions in the healthcare system with the goal of ensuring that the best health and healthcare are accessible and affordable to everyone in the country. So today we're going to be joined by my colleague Sofia Tripoli, who is the Director of Healthcare Innovation at Families USA. We also will have Dr. Bob Berenson, a visiting scholar and advisor on health value initiatives, and we're going to have several members of our steering committee. So the organizations that make up our steering committee, our key partners in this work, are listed on this slide. And I invite any steering committee members online at this time that want to quickly introduce themselves are welcome to do so now.
Hi, this is Sean O'Brien with AFSME.
Hi, it's the other Sean Grimminger with the Pacific Business Group on Health.
Kelly Troutner from the American Federation of from the American Federation of Teachers.
Hi, Avery Pakulis with First Focus on Children.
Hi, Erica Siski
Awesome.
from the American Academy of Family Physicians.
Awesome. Thank you all for introducing yourselves. It's always a little tough via phone to get everyone in, but those are our key partners. And again, at the end of the webinar, we're going to have an opportunity to hear a little more from them, and we can all kind of answer your questions. So we just wanted to give you that kind of brief overview of the key partners we're working with here. Right now, I'm going to turn it over to Sofia Tripoli, who is going to walk through the comments and the rule and why we really hope you can join us.
Awesome. Thank you very much, Jane, and thank you to everybody for joining the webinar and to our incredible partners in the steering committee. I'm excited to be here today to talk about a really important opportunity. So as Jane mentioned, we are all very familiar with the fact that the cost of healthcare in the U.S. is increasing at a staggering rate, and that we are heading towards a healthcare cost crisis in this country. The cost of American healthcare is both a profound economic problem and an urgent public health problem, which is now being further impacted by the COVID-19 pandemic. As you can see in your slides, 44% of the public don't see a doctor when they need one because of the cost. 30% report that medical care interferes with their basic needs. 74% of the public feel that we do not get good value from the U.S. healthcare system. As Jane mentioned, considerable efforts have been made by policymakers, providers, academics, advocates, employers, to address the cost and quality challenges we have in the healthcare system, but we continue to see that healthcare prices are rising without commensurate improvements in quality. So at the heart of our work of Consumers First, we are recognizing that missing from a lot of these efforts to drive value in our healthcare system was a unified coalition that brought together employers, labor, primary care, children, and consumers all working together with a unified voice to insert consumers' interests into policy development that governs our healthcare payment and delivery system. Fundamental to our efforts is to bring those interests together and forward to improve the ways in which our healthcare system is broken that is resulting in unaffordable care and poor health outcomes, such as how healthcare is paid for. Next slide, please. One of the ways we can influence the way healthcare is paid for and delivered is by responding to various proposals the federal government releases on the types of payment and delivery changes they are considering, which is, of course, one of the reasons why we are here today to discuss the current opportunity to join Consumers First efforts. At the end of May, the federal government released its annual updates on the regulation that determines how hospitals are paid for inpatient services, referred to as the Hospital Inpatient Prospective Payment System Proposed Rule. They are seeking feedback and input from the public on the ways they are planning to make changes to how healthcare is being delivered and paid for in the Medicare program. Now, the changes made to the Medicare program often set the benchmark for how healthcare is paid for and delivered in Medicaid and through private insurance. So this is an important opportunity for us to influence policy change that has the potential to ripple through the healthcare system. The Consumers First Steering Committee has analyzed the federal government's proposal, and we've written a comment letter detailing our comments and recommendations for improving healthcare payment and delivery, representing the interests of families and children, workers, primary care, and employers. So our ask to you is to join our efforts by signing on to our comment letter to ensure that the interests of our nation's families are shared directly back with the federal government. Next slide, please. So there are three critical reasons for you to join our sign-on efforts that we just wanted to briefly touch on. The first, of course, is that the COVID-19 pandemic has highlighted the ways in which our healthcare system is failing and all of the distortions in payment and healthcare delivery that we've all been working on for many years. So this is an important opportunity to share our collective expertise with the people in the administration who have the ability to make meaningful changes. Importantly, and this is probably one of the most important points, that submitting a comment letter to the federal government creates a legal obligation for the administration to consider and respond to our feedback. So they are bound by our comments once we submit that they must respond and they must consider what we're saying. And then third, and also super importantly, that virtually every hospital and hospital association across the country is putting lots of manpower and womanpower into reviewing this letter and getting their recommendations to the federal government representing their interests. So we think it's super important, Consumers First thinks it's super important that the government should also receive feedback supporting the interests of families, children, workers, and employers. Next slide, please. Okay, so now let's jump in. I'll walk through what our comments or our high-level recommendations are. So the first is around health equity. To make the Medicare program more effective, Consumers First believes that Medicare should be a leader among other payers to drive equity into Medicare payment and care delivery, particularly as we strive to build a high-value healthcare system. There continue to be millions of people, and in particular Medicare beneficiaries, who live with the burden of poor health, who systematically cannot access the right care at the right time, and who receive low-quality care. Those facing systemic inequities disproportionately include communities of color, those with low incomes, people with disabilities, and people living in distressed neighborhoods. The COVID-19 pandemic has further unveiled the harsh realities of existing disparities in health and healthcare in the United States, where Black, Latino, and Native American communities have experienced significantly higher rates of infection and death. Currently, 20% of Medicare beneficiaries are dually eligible for Medicare and Medicaid, most of whom live below the federal poverty level. About 13.7 or a quarter of Medicare beneficiaries come from communities of color, including the African American, Latino, and Asian communities. And currently, the healthcare system, the healthcare payment and delivery system is not designed to address or reduce long-standing health disparities impacting these communities. As a result, the healthcare system is not accountable for the ways in which it is providing poor quality care and resultant poor health to communities of color, those with low incomes, people with disabilities, people living in distressed neighborhoods. So our recommendation to the federal government to address health equity in the Medicare program that is within the regulatory bounds of this proposal is that they require hospitals to collect and report information on the quality of care provided based on race, ethnicity, primary language, geographic location, socioeconomic status, gender identity, sexual orientation, age, and disability status. This is a fundamental first step in being able to eventually being able to hold the healthcare system accountable for the quality of care and health outcomes for communities of color, people with disabilities, those with low income, and people living in distressed neighborhoods. Next slide, please. Our second focus in the comment letter is around price and quality transparency. Right now, the healthcare system blocks the ability of consumers, workers, and employers from knowing how much we are paying for healthcare until after the care has already been provided. This is a pretty remarkable concept that doesn't really exist in most other sectors of our economy. It would be like taking your car to get the tires replaced by the mechanic, but the mechanic not sharing the cost of the work until he or she had already completed it and handed you the bill. We wouldn't stand for it. The cost and quality of healthcare services is hidden behind proprietary contracts between health plans and hospitals. And although health plans and hospitals negotiate directly on healthcare prices, consumers and employers ultimately pay for healthcare provided through insurance premiums, deductibles, and copays, and yet we have no insight or oversight into the prices that are being set behind closed doors. So to address our nation's healthcare cost and quality crisis and to be informed purchase of healthcare, we must be able to have access to information about the price and healthcare and the quality of care provided. As a result, we are recommending to the federal government that they require hospitals to report on the price and quality of healthcare services so that consumers, workers, and employers know the cost and quality of care before we receive it. Next slide, please. The third comment area in which we're commenting on is around restoring competitive healthcare markets. Research now overwhelmingly indicates that the incredible increased consolidation of hospitals and health plans across the country is the primary driver of health and rising healthcare prices and costs in the United States healthcare system. The trend of increased consolidation over the last 2 decades has resulted in there being few truly competitive healthcare markets left in the United States. This is important because the federal government in this proposal is considering making a change to how Medicare pays hospitals by using prices that are determined in these consolidated markets. This would be extremely problematic because healthcare prices are the result of negotiations between insurers and hospitals who are battling for more market power, which then allows them to get their desired price to help the bottom line of their business. This is a practice that runs directly counter to the interests of families, children, workers, and employers. Healthcare prices determined in consolidated markets reward those who hold more market power, and this further entrenches the distortions in payment systems that drive low-value care for our nation's families. As a result, we strongly oppose the federal government making this change to how Medicare pays hospitals, and we are making the recommendation that they consider regulatory approaches to address the fact that we have highly consolidated markets, which are driving high and rising prices, by restoring competitive markets in the United States healthcare system. So that is an overview of our comment letter. The comment letter, which I'm going to turn it to Jane in just a second to talk about how you can access the detailed comment letter and how you can sign on. The comment letter goes into much more detail, but we wanted to just walk through sort of at a high level for folks, sort of our analysis and how we're framing our comments to the federal government. So with that, I'm going to turn it over to Jane, and then I think after that we'll open it up for any Q&A.
Awesome. Thank you, Sophia. So as Sophia just really, eloquently and quickly went through those high-level comments, our main ask today, we really hope you can consider joining these comments. Join the Steering Committee of Consumers First in submitting these. We know that historically many of our organizations have focused on healthcare access and coverage and have had a lot of success there in expanding that. But I think because a lot of our groups aren't often as deeply involved in conversations around delivery system reform and payment reform, a really strong consumer voice is sometimes absent from opportunities like this where the government is calling on stakeholders to comment on policy. So we're really hoping to get a strong showing of groups who represent organized labor, consumers, patients, providers, and employers, and kind of bring all of our voices together in those comments that Sofia just went over. So I'm going to share in a minute a link to a Google form, a link to our comment letter, and the sign-on form in the chat box. I think we'll also send that around after the webinar today. You can also reach out to Sofia, s@familiesusa.org, if you have any questions about the comment letter. And the deadline to sign on right now is next Friday, July 3rd. Of course, if you're not working next Friday, because I think it is the observed holiday, we encourage you to sign on by COB July 2nd, but we're going to keep the form open on Friday in case anyone wants to sign on then. So I think with that, we will open it up for Q&A. As a reminder, you can put those questions in the chat box. And as we're waiting for folks to add some questions to the box, I'm going to see if any of the steering committee members on the line have anything to add about, why they joined this comment letter, number one, why this issue is so important and what it means to the populations they serve. So I know there's a bunch of you on the line. Maybe I should call on someone to start, or I'll give someone bold an opportunity to jump in. So I'm gonna call on Sean Gruminger from the Pacific Business Group on Health. Sean, do you want to say anything about the comments and why they're important?
Yeah, thank you very much, Jane. First of all, I just thank you for your and Families USA's leadership on this. I think of all the three different pieces that are included in the letter, the one that I find and that EBGH is particularly excited about is really around the price transparency. It's as large employers and payers for healthcare, it's sort of absurd and obscene that we don't know in advance, or even often until well after the fact, what we're paying for. We don't know how much we're paying for. The health plans have negotiated prices with providers that are secret, and even though theoretically they're supposed to be working for us, we're completely in the dark. And I think there's no way that we're going to create an actual market for healthcare in the United States until we get to something approaching price transparency. So I'm really pleased that it's surprising for me sometimes to praise the Trump administration, but really pleased that the administration has been pushing forward on this, and glad to see it in this rule. The other piece that I would say is that, as you said, these rules are they're meaningful in that even if this is the last year of a Trump administration potentially, they really set a standard for what the future is going to look like, and I think there's a real opportunity here to make a difference. So again, thank you very much for your leadership, and I'm happy to support.
Awesome, thank you, Sean. I'm going to see if one of our friends from either AFSCME or AFT want to chime in.
Sure. This is Sean OBrien. An important point to keep in mind is while this this rule applies specifically to Medicare, and we care an awful lot about Medicare, it also has important implications for lots of things outside of Medicare. Many of our members are in employment-based plans, and what Medicare does is very relevant to their experience in those plans. So, for example, when we're talking about the alternative payment models and the quality measure reporting, what Medicare does affects what the private sector does as well. And these alternative payment models are and the quality reporting are really important. As I think Sofia has mentioned, we really need to get the right focus on creating the right incentives for the healthcare system, and that's why sort of the quality measures are so important. It's not an easy job, and getting it right, especially when we're talking about having the right incentives for addressing health disparities, making sure we're not creating, whether intentionally or through oversight, the wrong incentives is really important. I think, another important piece of this is Medicare prices. This goes to the last part of the comments that was mentioned, the proposal to shift how Medicare prices are set for hospitals. Medicare prices are also important outside of Medicare, whether it's employment-based health plans that may look to Medicare prices as sort of a reference price, or some of the sort of emerging reforms in other areas, for example, public option proposals that also try to sort of key off of Medicare prices as a way to get costs under control. So, the content of these rules are important, not just because we care a lot about Medicare, but because they also have broad implications for lots of other areas within the healthcare space.
Thank you, Sean. Really, really good point about that. So we do have one kind of question in the chat box, kind of around, how can groups that aren't on the steering committee get more involved in this work, or just, a question about what are we planning going forward. So we want all of you to get involved. We're hoping to, in our call to action, which we can also share as follow-up, we want to build this into a movement with all of our groups from the different corners. And I think, Sophia, you can probably say a word about the plans for this summer and potential future webinars.
Sure, yeah, and I think, to stay looped in on Consumers First, if you're not already joined or are participating as part of sort of our Consumers First list, reach out to me or to Jane or to anyone, and we can make sure you get added to that. As there's also a question if you go to sign on that asks if you'd like to be added to the list. And that's just helpful to get announcements about webinars and key actions going on, both legislatively and administratively, and other updates about Consumers First activities. I think in terms of this summer, stay tuned. This is our first, this is the first of a series of proposals that will come out from the federal government around healthcare payment and delivery. And so we will plan to hold at least 2 more of these webinars as we're working through other comment letters that we are anticipating to come down the pike these next few months.
Great, thanks, Sophia. So I think before we wrap, I'll just see if there are any other steering committee members on the line that wanted to say a quick word about the letter. So I'll pause for that.
This is Kelly from the AFT. I just want to reiterate what both of the Seans had to say, and also thanks to the team at Families for taking the lead on drafting this really important letter. I think, with the federal government as the largest payer in our healthcare system, in a lot of states the only regulator of care, it's really important for shaping the rules in the Medicare structure to really establish the rules of the game. So the transparency pieces are really important. The focus on outcomes and particularly integrating the health disparity reduction measure into the IQR program is really important. And for us at the AFT, we've really been digging in at the forces of consolidation and this upside-down power structure that has emerged that really puts patients at the bottom of the chain of command in how healthcare is delivered and how it's paid for and how much it costs. Our members are consumers, they're patients, they're workers in the delivery system who want the best for the patients they serve. And as an organization, it's really important to us and to President Weingarten that we no longer avoid confrontation with the cost of health care with substandard patient care outcomes or the inequities that are perpetuated by the way our healthcare system is financed. So this is a really important step for us, and we're really happy to stand shoulder to shoulder with all of the other organizations on the steering committee and hopefully everyone else on the line who will hopefully sign on to this really important letter.
Thank you so much, Kelly. So we're almost at the half hour now, and if there's anyone else that wants to say a quick word, but if not, we will begin to wrap. All right, well, we really appreciate everyone's time today. Thank you for joining the webinar. Again, I did put the comment letter and the sign-on form in the chat box, and we'll be circulating those afterwards along with the webinar recording. So again, thank you again. We really hope you can join us in kind of building this into a healthcare value movement that's really focused on what's best for consumers and their families and their employers and the primary care providers that serve them. So thank you all, and hope you have a good afternoon.